The Toulmin method. Resolved science is leading America in the right direction. We agreed that science improves at the rate of greed. Our claim is, as science and medicine improve, the healthcare system continues its vicious cycle of overcharging, overprescribing, and leading a monopoly. Our grounds are that, according to the Clinton Courier, the leading cause of bankruptcy in the United States is from medical debt. The National Library of Medicine reports that the U.S. medical system has historically always been a business, initially owned by small entrepreneurs. The average cost of a 3-day hospital stay is around $30,000, as reported by healthcare.gov.
So, our warrant is that medical costs are too high in the United States because of all the debt. Access to healthcare is uneven and disproportionately affects the unemployed, poor, and minority populations. The privatized system of healthcare that the U.S. operates allows for the greed of hospitals to be more important than helping the people. People should not have to choose between what is best for their health and what is best for their bank account. Roughly 23 million people in the U.S. are in debt for medical expenses, according to KFF.org.
So chances are people in healthcare are making big dollars off of helping struggling people. Stats on NPR note doctors in the United States make more money than other places such as Canada and the UK. Canadian doctors may earn $200,000 yearly rather than in the US $400,000.
And that was our qualifier. So our rebuttal is that although some apps exist that will lower the cost of certain drugs, it's not available for all drugs and for everyone. GoodRx can lower the price of prescriptions that are not covered by an individual insurance, but this is only useful if you have a smartphone, you don't have insurance, take certain medications, and have a doctor that works with GoodRx. So all these factors have to line up. This app was reviewed by Trust Radius, that's where our source is from. And since the United States doesn't have Medicare, the wait time for operations or seeing specialists is lower. In the US, 23% of people wait over 4 weeks, while in Canada, 57% of citizens wait more than 4 weeks. And that statistic is from the Clinton Courier. So although people in Canada may be waiting longer, it's cheaper and a lot more affordable.
Our backing is that, according to the Commonwealth Fund, in other countries like Canada, Medicare exists, and regulations are in place to make help attainable so people will not become in debt. Harvard Medicine found that access to healthcare is uneven because health insurance is often tied to employment. As of November 2021, 9.6%, that is 31.1 million U.S. residents, lack health insurance, based from the reports from the American Hospital Association. Hispanic 31.4% and Black 14.7% adults were most likely to be uninsured. As of 2020, by the United States Census Bureau, there were 37.2 million residents living in poverty, and this number is rising.
So that number has risen over 3 million from 2019 to 2020, and so this really shows how the price of medical costs in the U.S. really disproportionately affects minorities, because Black people and Hispanic people are more likely to be under the poverty line, and they're also more likely to be unemployed and uninsured. Therefore, the high cost is affecting them most likely.